You guys are good.
Okay, so hello everybody. Today we have Dr. Sanj Mohanta, and she will be giving us a presentation about her path through dentistry and give us advice, and we'll walk through some cases with us. So you can go ahead now.
Thanks, Janine. Thanks, Sophia. And thank you to Tara for inviting me, Fresh Dental Shadowing for welcoming me, and for all of you for spending your Friday night with me. So this is going to be a very engaging, dynamic, not serious at all presentation about my journey into dentistry and how I found my path. So let's go to the next slide. So a bit about me. My name is Dr. Sanj Mohanta. My patients call me Dr. Sanj. I practice in Brampton, Ontario, Canada, and that is also where I grew up. And it was absolutely freezing here today, so I hope you all stayed warm. I know a lot of you are on the West Coast, so enjoy the sunshine. So what is the purpose of shadowing? Well, it's actually fantastic that we have groups like Fresh Dental Shadowing that are doing virtual presentations, because the whole purpose is to figure out, do you really want to be a dentist or not? And yes, you can get that, in person in a dental office shadowing, but it's really hard during COVID. But you're actually not learning that much going into a dental office, because you're standing at the back, you're really looking at the back of the dentist's head most of the time. You're really gaining a lot more information watching these virtual dental shadowing videos. So I watched a lot of videos on Fresh Dental Shadowing, and I was so impressed with the questions and answers, especially the questions that you guys asked, and also all the different paths that the dentists have had and shared. And so you're getting a lot more information watching these videos than going in someone's office and just watching a procedure from the back. So kudos to all of you guys for watching these videos. So what will you learn? What I'm going to share with you is the good and bad of dentistry, the different paths in dentistry, the typical day of a dentist, and how to be a happy dentist. So I'll be talking about my journey into dentistry, my life as a dentist in public health, getting involved, giving back, and at the end, I'll be showing you some cases. And then the best part is answering all of your questions. So here is my contact information. You can email me at sanjuktamohanta@hotmail.com or send me a DM on Instagram at Dr. Sanj Mohanta. And I answer all my DMs, and I'd also be happy to have some Zoom meetings with you to help you with your applications, do mock interviews, review your personal statements. I want to help everyone get into dentistry because I love it so much, so I'd like you to join me. So a bit more about me. I have a dog named Dude. She's a golden doodle. And here she is dressed up like me, helping me on a virtual classroom presentation to kindergarten students on oral health. And this is my family. My daughter Maya is 17 in grade 12, and she wants to be a hairstylist. And my son AJ is 19, and he's in second year university at the University of Waterloo in Ontario, Canada. And that's where I did my undergrad. So neither of my kids want to be dentists. Actually, when they were applying to courses for grade 11, I said, why don't you take biology? That's what I majored in. And they're both like, biology? That's science. That's research. Why do we want to do that? So that's totally okay. They're following their own path, and that's what this presentation is all about, following your path. Okay, and this is my other family, my dental team. So I work with a fantastic group of people, and I look forward to going to work each day. I'm smiling like this the whole day. I'm walking down the hallways. Every single day I say to myself, I can't believe I'm getting paid for this. It is such a great job. And I wish you all the best of luck in your journeys into dentistry. And I hope you have as much fun as I do. So how did my journey start? Well, look how cute I was when I was 7 years old. I was in my dental chair at my dentist's office, and I got a special award. I got on the wall for the No Cavity Club. And look at me, like rocking that blue jacket. Like I look like I just came off the set of Stranger Things. I'm like missing my front tooth. But I used to love going to the dentist. And then in grade 10, I did my science fair project on, which toothpaste is the best. So I took like pieces of potatoes and rubbed Q-tips over my teeth to wipe off the plaque, rub them on the potatoes, and grew the bacteria in petri dishes in my bathroom to try to figure out like which toothpaste is more effective at removing plaque. So the answer was Colgate, and I got an award. And my outfit here is really bad, so don't focus on that. Focus on the little medal that I have, which I was so proud of. So, but then something really bad happened when I was 18. I had to get all my wisdom teeth taken out, and my dentist decided to do it himself, and just with local anesthetics. I wasn't put to sleep, and it was a really, really bad experience because I can see him cutting my teeth up into smaller pieces, drilling bone. So it was a traumatic experience for me. And I realized, and that's when I said to myself, I do not want to be a dentist. I said, there's no way I can do this on other people. So I guess that was like my first shadowing experience, just watching myself get my wisdom teeth taken out. So then I decided to become a university professor. So during undergrad, that's what all my courses were geared towards. And a lot of my courses were with things like plants and animals. And I was a teaching assistant during third and fourth year. And during fourth year, I did a research project, like a mini master's. And after a month, I hated it. So just think about the position I was in. Fourth year of dental school, of undergrad. My whole 4 years planned to become a university professor, do my master's, PhD, teach, write articles, do research. And within 1 month, I said, there is no way I can do this. And the reason why is because my research project was on crickets. So I had to go into a room full of bugs, not just crickets, but all the other bugs that the other researchers were working on. And the bugs were loose. They didn't stay in their containers. So I'd have to tape up my sleeves, tape up my pants, button my shirt, and walk into this room full of bugs. So if you ever watch Indiana Jones, when Indy has to like put his arm through like this little hallway, like a little area so that he can grab something, that's what it was like. And so I realized I did not want to spend the rest of my life working on bugs or animals. So I went to the guidance counselor at my undergrad university, and I said, I have a science degree. I'm in fourth year. I definitely do not want to do research. What else could I do? And she opened up a filing cabinet, and there was only one thing in it. And that was an application to write the DAT. And I never heard of the DAT before. And she said, you better apply for this right away because the DAT is being written in 6 weeks. And back then, everything was by mail. The internet was just in its infancy. So I had to mail in my application, wait for them to mail back, practice tests and soaps to practice carving on. So in November, I did my DAT, and I was surprised. I did really well. I was in the top 10% of my peers, and I didn't have much time to prepare. So I spent 12 hours preparing for the DAT. That was it. And you're probably thinking, gosh, I'm so lucky, Sanj. Like, stop showing off. The main point of this is that I was so focused. I hated crickets so much that I tried to do anything to get away from them. So I realized I had very little time to prepare for my DATs. So I'm going to focus on the spatial analysis part and the soap carving because my reading comprehension was already good. I was taking a lot of biology courses, so I didn't have to study for that. And thankfully, all the questions on the DAT were things that I was familiar with when it came to the life sciences portion. So thankfully, I had all the prerequisite courses as well. And I put my application in for the only 2 schools in my province, Western and Toronto. And when I looked at the tuition, which was $10,000 a year, I said to myself, oh, that's way too much money I don't think I can afford that. But then I kept thinking, Sanj, crickets. And I thought, okay, I'll figure out a way to get the money. So I got some student loans. Thankfully, I got into both schools on the waiting list. So we started school in September. I found out at the end of July that I got into both schools, and I accepted the University of Toronto, which was closer to home. So I went to high school in Brampton at Turner Fenton Secondary School. Shout out to anyone watching from Brampton. I did my first year of university at the University of Guelph in Ontario, but I socialized way too much. My grades weren't good, so I transferred to the University of Waterloo for biology. And then I went to the University of Toronto Faculty of Dentistry. So back then, to get into dental school, they only looked at our grades, our DAT scores, and our personal statements. Now we have the interview and the CASPER. So like I said before, if you need any help, please ask me. Back then we didn't have, pre-dental groups to help us, or, DAT crushers and boot camps, but now you do. And now you have each other. You have this fantastic community to help each other. So I'd recommend that you do that. Do those mock interviews with each other, read each other's personal statements. And my tip for the personal statement is, just don't write down things like, oh, I volunteered at this organization, I went on this mission trip, I organized this event. Create a story. So that means talk about your feelings, your struggles. Maybe you're in a leadership role and that was the first time you ever were. And you were worried if you can actually achieve the results and lead the team. So talk about that. Talk about how you overcame those struggles. Talk about the final outcome. So they really want to see some character growth and some reflection and how you overcame struggles. That's what should be represented in your personal statement. Even with the interview, even though they're going to ask you case-based scenario questions, but try to bring your own personal story, make a connection. So if they're asking a question about what would you do if your friend was cheating on an exam, try to connect that back to a similar situation that you were in. Try to think about, what are the core issues here? The core issue here is dishonesty. And then also think, okay, how can we prevent this from happening? So it's not just, well, my friend should have studied more. Well, it should be things like, well, maybe like systemically there's something wrong. Like the exams are so close together that people feel they have to cheat in order to do well. Or, that there's not a lot of help throughout the year. Or there aren't teaching assistants, there's no tutorials, the exam is weighted too high. Like, what are things that lead people to cheat? So even talk about your own situations where you were dishonest. So that's what people want to hear. So then dental school. So first and second year, a lot of theory courses. We're working on mannequins, typodonts, so simulation labs, and we're working on each other. And then in third and fourth year at the University of Toronto, we're working on patients. And we also had this really fun part where we did rounds outside the school. So going into hospitals, public health clinics, places where they treated people with disabilities or mental health issues. So I really liked that part because it allowed us to see, access to care issues and how to manage people with different concerns. And my favorite part was going to the public health clinic. So remember that because that comes back later on in my journey. So during the end of fourth year, we wrote an NDEB exam in Canada, which was just a one-day multiple choice exam and just written, no hands-on, proved our competency. So by passing the NDEB and passing all our credits in dental school, we were able to graduate and get our license. Now, what I liked about dental school, number one, my classmates, my biggest strength in dental school was making a lot of friends. I didn't do very well in anything else. I also liked having a lot of instructors, having a variety of clinics, doing a lot of variety of procedures, working with patients. So I liked how each day was different. And we're learning a lot every single day. things I didn't like, learning new skills, because it's so hard to learn a new skill. Like, we're so used to doing so well academically, but this is totally different. We're working with our hands, we're doing things we've never done before, and we were constantly being evaluated. So for every step, you were given a mark. So it's quite harsh to be evaluated every single day, several times a day. And then you always get this feeling that you're just not good enough, because there's a steep learning curve. It takes a long time to learn something. Other challenges of dental school, which is getting enough clinical credits. Like, in order to graduate, you need a certain number of fillings, extractions, crowns, bridges, dentures, which is really hard because sometimes your patients don't have those procedures that you need. Sometimes your patients don't come in. And so that was really challenging, is finding patients. So my favorite part of dental school is working on kids. So remember that as well, because that's going to come up later in the presentation. However, I had a lot of challenges in dental school. In first year, I failed one of the courses. So during the summer, I had to go back and redo the final exam, which I killed, by the way. So I felt much more confident going into second year. But then in second year, when we're in a simulation lab and working on typodonts, I was having a really hard time. And so the lead instructor came to me and told me that I needed more help. And I started crying in front of him. And he's like, all this means is you need more practice. And I went, oh yeah. So then I spent my lunch breaks, going into the simulation clinic and just practicing. And within a short period of time, my skill level was just as high as everyone else in the class. So then I was competent enough to go into third year and work on patients. So I never thought I'd graduate, but I did. And the funny thing is I started dating my husband the first week of dental school, and we got married the last week of dental school. And my hair looked a lot better when I got married than it does here in this picture, trust me. But the funny thing is he was probably thinking, oh, I'm marrying a dentist, freedom 55. But that's not how it turned out. I went into public health, which doesn't make as much money, but which is a very rewarding area of dentistry to work in. And my husband actually told my kids, we would have a much better lifestyle if your mom didn't care so much. But that's okay with me, because we have a great life, and I'm happy going to work. I'm happy at home because I'm doing what I love. So there are so many different pathways in dentistry. So one of the things I recommend is that after dental school, you do a 1-year residency. So that's like called a GPR or AED. And that means you get a lot more experience with procedures, and you're getting mentorship as well for another year. And you're getting to see a lot of cool things that you didn't see in dental school, because most of the residencies are affiliated with hospitals. So you're actually getting to see things like trauma and learning more about the medical side of the health profession. With dentistry, you can work part-time or full-time. Some of my friends work 6 days a week. Some of my friends just work half day a week. And guess what? Doesn't matter how many days a week you work, you're still called a dentist. So you need to choose what's best for you. So when I first graduated, I was an associate, which means that I worked for a principal dentist who owned an office. You can also be a practice owner. You can also be a multiple practice owner. So some of my friends don't do any dentistry at all. They own several dental offices. You can be a specialist, like an orthodontist, an oral surgeon, root canal specialist, which is an endodontist. So you can pick a specialized field that you really enjoy doing. But even as a general dentist, if you really like doing braces, you can focus your practice just on braces. You just can't call yourself a specialist. You can't call yourself an orthodontist. Just be clear with the patients in your advertising about that. You can be an educator. You can work in public health, which is what I do. You can go into research, sales. You can be an entrepreneur. One of my friends, sold his dental office to start a dental app for, dentists to find temporary staff for their dental offices. So you can even stay within dentistry, but never pick up the drill. So just do what makes you happy. So what I did I was a dental associate for 7 years. I have been working in public health for 15 years. So I've been a dentist since 1999. And while I was working as a dental associate, I also worked as a clinical and theoretical instructor at a dental hygiene school. So what I liked about private practice, you get to do a lot of different procedures. You get a really good income. I was able to pay off my student loans in 6 months. Now, mind you, the tuition was a lot lower back then, but I was busy from the beginning, and it's compared to what I was making when I worked at a movie theater or a Canada's Wonderland, which is an amusement park. I couldn't believe how much money I was making right after dental school. The other thing I liked about private practice is learning the business side. So we learned about like how much production comes in, how much materials cost, how many new patients you should have each month, how much money you should be billing per hour, what percentage of your production should go towards staff wages and material costs. So that's really good, because then you can decide whether you want to open up your own practice or not. And another great thing about private practice is the tax savings, because you're considered an independent contractor, not employee. So then you get to reduce your taxable income by claiming things like your professional associations, your uniform costs, and the continuing education courses you take, and other things as well. So things I didn't like is I found that it focused more on production and not so much on the patients. And I'm very patient focused. So I just found that there was too much emphasis on the financial part. I always felt uncomfortable charging for fees. I felt very uncomfortable when someone said that they couldn't afford the best type of care, so they went the cheapest route and just took out the tooth instead of saving it. That always broke my heart. The other things about being an associate is if the patient doesn't show up, you don't get paid. You usually get paid a percentage of production. Also, if the patient doesn't pay, you don't get paid. And the other thing I didn't like about private practice is I didn't always like the management decisions. Like, they are the ones hiring the staff. They're the ones setting the policies. Sometimes I didn't agree with that. So I went into teaching at a dental hygiene school, and I love being in the academic environment. Everyone is supporting each other in their growth. It's amazing to see how quickly the students are learning new knowledge and skills. And even it helped me learn new things as well, because I had to relearn everything I learned in dental school so I could teach it in the most effective way so students can understand. What I didn't like, poor salary, you have to spend a lot of time at home prepping, and again, some management decisions. If you're not in charge, you're not always going to be happy with what other people decide for you. Okay, and then I was kind of unhappy, and then something happened. So this was my boy when he was 4 years old, and one day I was leaving to work, and he goes, "Mommy, where are you going?" And I said, "I'm going to work." And he said, "Why are you going to work?" And I said, "To make money." And he said, "Is money more important than us?" And I was like, wow. Like, I couldn't believe how profound this 4-year-old was. And my daughter was 3 at the time. Then I realized, you know what, if I'm going to leave them, like, I'm their only mother, then I have to leave them for someone who needs me more than they do. And I remembered back in dental school, what did I like doing? I liked working on kids, and I liked going to that public health clinic. So that's what I did. I left my associateship, started working at a public health clinic. So what I like about public health, my 2 favorite groups to work with are children and seniors, because you can make such a big difference in their lives. And, they really listen to, our advice with oral hygiene instruction. They try so hard. You can make such a big difference, not just with their mouth, but, their overall life as well. Like, I encourage children to follow their dreams, especially when they say they want to be a dentist. I get really excited and, empower them to do that. With seniors, I know a lot of them are suffering with health issues and isolation. So, I'm happy to be there to talk to them. And I like helping people who need it the most, so the vulnerable population. I like that there are no fees involved. I can focus on the patient. And with public health, I get a salary, I get benefits, I get pension, I get set hours. So there's a lot of certainty that way with the wages. What I don't like, very limited procedures, because public dental plans just do basic dentistry. So, we're not doing major things like bridges and cosmetic work and implants. So it's very basic work like restoration, so fillings, cleanings, and extractions. The other thing I don't like is I want to help everyone, but we also have rules at our public health clinic as to which groups we can see. So unfortunately, I can't help everyone. And again, some management decisions I'm not happy with. So the work-life balance is really important. So I just told you, 3 paths that I took: public health, which I'm on now, teaching, and being an associate. So there are other paths as well. No matter what path you take, you're in charge. So you have to find your happiness. So I told you before how I was really unhappy in the first few years of my career. I was so unhappy I wanted to quit. I was so unhappy. I was burnt out. I didn't even realize what that word was. I didn't realize what I was going through, but I was miserable going to work. I didn't care about the patients. I did horrible dentistry, and I didn't even care. And I'm ashamed to say that, but I wasn't in the proper path. I wasn't on the proper path, and I didn't have the proper mindset. I was very mean to myself. I was very critical. I was always striving for perfection. And because I couldn't get that, I was berating myself over and over again until I burnt myself out just with the negative messages I was saying to myself in my mind. So what I learned from that is we're in charge. So we can set how much time we need for procedures, which days we're going to work, what hours we're going to work. We don't have to do every single procedure. Even though we learn a lot of different procedures in dental school, just do things you're comfortable with and refer the things you aren't comfortable with. So, and also you need to take some time off, and especially the most important thing is take a lunch break. There's so many dentists who work through their lunch. They work all day without eating, some of them not even drinking anything. You can't take care of someone else if you're not taking care of yourself. So I told you how I was an unhappy dentist, but now I love dentistry. So what do I like about dentistry? The patients, number one. I feel like I'm working at a coffee shop, and every single hour, one of my friends comes in, I get to sit down with them, chat with them, help them out, wave goodbye, and then my next friend comes in. That's how great my life is right now. Each day is different, procedures are different. I like working with the team. I like how we're constantly trying to improve. Like dentistry is great because there's always new materials, new equipment. We're always doing continuing education. So we're always just trying to get better. I like working with my hands. I like working with my mind, but most of all, I like giving with my heart. And we're doing all 3 with dentistry. What I don't like about dentistry, the fees, the time constraints, all the regulations we have. Patients come in with anxiety, high expectations. Sometimes they complain. It's a very isolating job because you're working in a small environment like a mouth, a small operatory that's smaller than a jail cell. Now we have enclosed rooms and closed doors, and we have, our face shield on, and we're concentrating on a single tooth. And there are not a lot of people we can talk with all our issues about, even though we're working with a lot of other people on our dental team. Everyone is so busy that you don't have time, after a patient just to say, you know what, that didn't turn out the way I wanted. After a difficult procedure, you have to bring the next patient in and just keep going. So it's very isolating. So you have to make the effort to connect with your colleagues. For my friends who own practices, they say their number one issue is staff issues. First of all, there's a staff shortage. So some of them can't even find enough staff to be able to manage all the patients they have. Staff wages have increased. They are having trouble with finding competent staff, training their staff, finding staff to work set hours, dealing with staff issues, staff conflict. So it's really important to learn things like communication, leadership, conflict resolution, marketing, practice management to help you with the business side of dentistry. And I think the worst thing about dentistry is things don't go as planned. And this happens almost every day. So just get used to it. Things are not always going to go your way. Okay, so how much do dentists make? So on average, dentists make $200,000 per year. So these are Canadian stats. So I make about $120,000 a year in public health. Associate dentists make a percentage of collections. That's usually 40% of collections, and they're considered independent contractors. Specialists make more than general dentists. People who own their own office make more than associates. Most dentists work 4 days a week, and most dentists work one evening a week and every other Saturday. So expect to work evenings and weekends as a general dentist. So struggles in dentistry, mastering your skills. Sometimes you spend a lot of money on continuing education courses. You spend a lot of time, working with specialists, trying to master your skills, and you still can't get it, which is very frustrating. Finances, because everything in dentistry is expensive, including the tuition to become a dentist. It's also hard, because we're high achievers. We tend to do very well in everything. And then we get into dentistry, and there's a lot of things we can't control, and not everything's going to be perfect. We, other struggles, we say negative things to ourselves all the time. We compare ourselves to others. We want control, and in dentistry, there are things out of our control, like even the patient's saliva. Sometimes you're doing a very simple procedure like a dental sealant, and there's so much saliva that you can't get the sealant to stick to the tooth. And that's really frustrating because you want that control. We want to get it right. Dentists often don't ask for help when we need it. So we internalize and we're isolating ourselves. And dentistry can be a physical strain. I'm lucky that I've never had any back issues, but many of my friends have. So it's really important to take care of your health, your mental health, your physical health, and if you have negative mental health, it's going to cause even more back, neck, and shoulder issues. So it's really important to take care of your self-care is so important in dentistry. So that way you don't burn out. So finding happiness in dentistry, how did I do it? I connected with colleagues. I started speaking out about my struggles. I realized that I need to make some changes. I had to leave, associating and go into public health. I started doing more self-care. So yoga, exercise, mindfulness, meditation, journaling. I changed the voice in my head from being a critic to a cheerleader. I started eating healthier, making sure I slept, 7 hours a day. I got more involved in my hobbies, and I asked for help when I needed it. So these are all the things, not just to find happiness in dentistry, but to find happiness in your life, no matter what career you choose. So getting involved, I joined my local dental association, became the president. I am involved with my provincial dental association. I'm a chair of one of the committees. I'm also on the advocacy committee for the Canadian Dental Association. I successfully delegated to keep water fluoridation in my region. I joined a study club. I became a mentor to many people. I advocate, like I said, not just for water fluoridation, but to improve publicly funded dental programs. I write articles, I do research, I educate. So all my hobbies revolve around dentistry. That's how much I love it. And just think, at the beginning of my career, I hated it and wanted to leave. Like, what a difference now. I'm involved with giving back. So I volunteer, I'm involved in fundraising, donating. I support charities. We support local businesses, free dental days. You can even get involved with mission trips. Mentoring and educating is also giving back too. Even something as simple as posting things on Instagram so that your friends can learn, about the different things you do or different things that you learned. That's giving back as well. So I do classroom presentations. I love doing that. With advocacy, I meet with my local politicians at least once a year to talk about increasing public dental programs. And we also even do petitions as well on different topics. For educating, I speak at dental conferences, like provincial dental association conferences, and to dental hygiene groups, dental assisting groups, my peers. And I also write articles for my local dental journal in Ontario, as well as a national dental journal as well. And I've written for a couple of American dental journals. So that's a great way for me to share my research and expertise with others. I'm on the editorial board for one of those journals. I volunteer with a dental charity called Gift from the Heart, where we do free dental days. So here's a picture of me at a homeless shelter where we did free dental screenings. We also do free dental days where assistants, hygienists, dentists, and administrative staff all get together to help people in need. It is just such a fantastic day. I recommend that when you do start working as dentists, that you do this at your offices. And I say the best thing that I do is mentor. So this is me with my friend Ivana. So she started out as a dental hygiene student at the college that I worked at. Then she became a dentist. And then I asked her to join my local dental association, where she became a committee member. I asked her to come with me to some volunteer events like this for the Special Olympics. And now she's one of my best friends. So the great thing about mentorship is that it starts off as a mentorship, but then they become your great friends. I'm involved in organized dentistry. I'm involved in lots of different committees, lots in general council, and being a political contact representative. And the great thing about organized dentistry is you get to meet a lot of your colleagues, and that's going to help you with feeling less isolated and talking about your struggles with each other. Life as a dentist, I love being a dentist. This is me in my operatory with one of my favorite patients. So my typical day, so I work 4 days a week, Monday to Thursday. 3 of those days I work 8 to 4, and on Wednesdays I work 12 to 8, and I work some Saturdays. I get a 1 hour lunch break. Most of my dental appointments are 1 hour, and I mostly do fillings, extractions, and dental exams. And like in dental school, after each procedure, I do an evaluation of myself at my communication, infection control, time management, how I provided a good patient experience, how I worked with my dental assistant, was it the proper diagnosis, was it the most ideal treatment. So if you do that, you're constantly going to get better. And if things didn't go well, instead of berating myself and saying, oh, that was a crappy job, I can't believe you did that, I'll just say, okay, next time I can do this better. So instead of saying you're not good enough, just say you're not good enough yet, or I can fix this. My weekly personal routine is I go to bed from 10:30 to 5:30. Then I walk my dog 3 times a day. I also walk during my lunch break. I exercise 4 times a week for 1 hour. I eat 4 healthy meals a day. I do yoga and I meditate and I practice mindfulness. I see my friends several times a week. And the best part of my week is all the volunteer work I do, like the mentoring and the organized dentistry and writing and speaking and doing things like this. So if you look at my weekly routine, it's quite regimented. I'm like a US Navy SEAL. People say that the thing that they're most impressed about me is my routine. But routines work because then I know that I'm doing something healthy and being the best dentist I can be and the best mom and wife and friend as well. So we'll go into cases now. So this is the father of one of my patients. So normally we don't see adults in my clinic, we see children and senior, but the father reluctantly showed me his smile, and he never smiled before. He lifted up his upper lip, and I saw how big the cavities were between his front teeth. And this is a low-income family, and the father wasn't working. So it's very hard for someone who looks like this to get a job. They're going to be judged. So the priority was employment because he was not working and the family was making a very low income, barely enough to make the rent. So when you see cavities this big and you see that they're very close to the nerve within the tooth, so that long line down the center of the tooth is a nerve. So that means we just can't do a regular filling here. We have to remove the nerves or root canal, but there's not much tooth left once you remove all the decay. So can we fill a tooth? Will the filling last? Probably not, because half the tooth is gone with decay. So now you have to do things like posts and crowns and removing a little bit of bone around the tooth so the crown can hold on to the tooth, which is called crown lengthening. So it costs a lot of money and it takes a lot of time. And this patient wanted something quick so he can get a job, and he wanted something that was low cost. So it doesn't matter how much money a patient makes, you have to give them all the different options for care. Don't just assume, oh, this person can't afford dental implants, so I'm not going to offer it. Offer all the options and let the patient decide. You'd be surprised how many patients want optimal care, even if they have a low income, and they will find the money. They'll get loans, they'll ask their family to help because they really value their smile. So in this case, the patient asked for his 2 front teeth to be removed and to have a removable partial denture. And it hurts my heart every time I have to remove someone's front teeth, but I did it for him and gave him a denture, and he looked so much better. He was smiling, his confidence improved right away, and he got a job right away too, because he was confident enough to go to a job interview. So even though he picked, the lower cost treatment option, for him, it was the best option. So let the patient decide. Okay, here's a case. This is sad because a 7-year-old girl who fell at school and her whole front tooth came out. This is a brand new tooth. So the mom came in 3 hours after the incident with the tooth wrapped in a tissue in her jean pocket. And she took it out and said, here's my daughter's front tooth. Can you put it back in? And with this situation, when a tooth comes out, it's called an avulse tooth. You want to put it back in right away. In this case, it has been out for 3 hours. It's completely dry. But I thought, let's give it a shot. So, we did all the procedures involved in putting the tooth back in. And you can see it looks great. It looked like it did before. And it actually healed. The bone healed around it. I couldn't believe it. But then she fell again. And it was her other tooth that came right out. And it was a holiday weekend, so the mom took her to a children's hospital that had a dental suite. They tried to put the tooth back in. She came back to me after the holidays, and I realized, and I saw that there was an infection in the gum. There was no bone holding the tooth in. It was just dangling there. So I had to tell them, it's really unfortunate, but I have to take your child's front tooth out. And I cried after I took it out. And the child with special needs, she was so well behaved. And I remember getting a call from the children's hospital that put the tooth back in. And the pediatric dentist said, how's the mom doing? And I said, why do you say that? And he said, you need to check on the mom. So while this girl was getting her x-ray, I took the mom into the next room and I said, is everything okay? And she said, no, I'm really having a hard time at home with my 2 girls. Both of her girls are special needs, and she's a single mom. And she said, I really want to end things. So I said, can you give me your cell number? I'll give you mine. I'm going to call you tonight. And so I was following up on her because she was at the point where she was having suicidal ideation because she was just overwhelmed with looking after these girls on her own. So the best thing I did for this family was actually helping the mom, connecting her with resources that can help her. The other great thing is, we provided a positive experience for the child where she was very cooperative with everything we did. And then we made a denture to replace the missing tooth. Okay, this case, so this is actually my son. When he was 7 years old, we took an x-ray and you can see with the arrow that he's missing a tooth. So what we did next was I removed the tooth, and now he's 19. You can see the other teeth have moved forward on the bottom with the white arrow. Everything's moved forward. The teeth that have red arrows on them are his wisdom teeth. Those were removed. But look what happened with the tooth with the green arrow. It has now moved down because it doesn't have a tooth to bite against. So this is what happens when teeth are removed, other teeth start shifting. So when you're taking out teeth, you always have to tell the patient your other teeth are going to move around. So we were hoping that, with braces and moving everything together, that he would have a good bite. But in the end, we ended up with one tooth without a partner. So now that tooth has to be taken out as well. Okay, this is me. So I fell off my bike and chipped my front tooth, and I couldn't find the piece. But I went to my dentist asking for a filling on my front tooth. And he said, well, where's the piece that came out? And I said, I actually looked for it. I couldn't find it. And then he knows my bottom lip was still bleeding. He's like, Sanj, I think your tooth is in your lip. I said, there's no way. Like, I would know if there's a tooth in my lip. And he took an x-ray, and you can see the white horizontal line for the bottom teeth on the x-ray on the right. There's my tooth. So then I went to an oral surgeon, my friend, and he's like, the tooth is really deep in your lip. Let's just leave it. So for months, I walked around with the piece of my tooth in my lip, but then it came to the surface where you can see it, but it was still underneath the skin. So then the oral surgeon's like, I need to cut open your lip and take that tooth out. So he did it from the inside. He cut up on my lip, spread it out, and dug, and not only took that piece out, but all the little tooth fragments out. So it just shows that if there is trauma, something breaks, you have to ask, where did it go? And it could be somewhere else in the mouth. So now I wear a sports guard every time I ride my bike, and it's hot. Okay, so second last case. This is a 2-year-old, and she came in because she had cavities on her front teeth. And doesn't look that bad on the picture on the left, but if you saw behind, the cavities are really bad. So then I said, okay, the option is, because she's not cooperative at the age of 2, she has to go to a specialist and get this work done under general anesthesia. And the mom did not feel comfortable with her 2-year-old getting general anesthesia, and I don't blame her. So I said, well, there's something else I can do. I can paint something called silver diamine fluoride on your daughter's teeth, and it'll stop the cavities from getting bigger. The only problem is it's going to turn the areas of decay black. So the picture on the right is how her teeth looked after the silver diamine fluoride, but the mom and the little girl did not mind at all. Like, we're in a pandemic right now. Kids are wearing masks. We're not seeing each other right now. So the mom's happy. The girl is now 4. I said, once she becomes a little bit more cooperative, we can do fillings on her front teeth before she starts school. So it's a great option, especially for young children, people who aren't cooperative, people who are medically compromised, to stop decay. So my last case is my most impactful patient experience. So this lady was abused by her ex-partner. She was afraid to come to the office. She actually came to the office, left, came back, and she wouldn't sit in the chair. She was shaking, and she said she's really scared. So I sat down with her, and we just talked about, I said, share your story with me. And she said that she was abused. Her ex-partner punched her. She had several broken teeth in the back. She went into hiding. Her ex-partner passed away. So now she finally feels comfortable to come out and start looking after herself. So she said that she didn't want her broken teeth fixed right away. She said the main thing is she didn't like the stains in her front teeth. So I did a cleaning. So after cleaning her teeth for 1 hour, I showed her what her teeth looked like in a mirror, and she was like a different woman. She's like, oh my gosh, that's me? I can smile again? And she was like walking around, wanted to show off her smile to everyone. And that was just from a cleaning. And I think the most important thing we did for her was just to make her feel comfortable. Because afterwards she said, so what should I do about my back teeth? I'll come back in, let's fix everything. So there's just, what a difference you can make in someone's life. Like, she had her self-esteem again. So that's how amazing it is like to be a dentist. So the goals: take care of your patients, but also take care of yourself, connect with your colleagues, keep up with the education even after you graduate from dental school, so continuing education. Instead of striving for perfection, strive for progress and give back. And my advice, ask lots of questions. If I could do dental school all over again, I would ask way more questions. I was too intimidated by my instructors to ask questions. So ask questions, ask for help, find mentors, do that 1-year residency after dental school, have an inexpensive lifestyle so you don't have to worry so much about finances. Stay connected with your classmates and friends. They will get you through all the hard times. Join dental groups like your local dental association, pre-dental groups like this, study clubs. Explore different paths in dentistry. And if you're unhappy, change your path. So that is the end of my presentation on my dental journey. And I'd be happy to answer all of your questions.
Thank you so much. I think that was a really impactful presentation. I especially like how you talked about your patients. It sounds it's just very inspiring overall. So we do have some questions. So somebody is asking if you could share more about what inspired you to start your application, I believe in your last year of university.
Mm-hmm. Yeah, so what inspired me, it was my only choice. I didn't want to do research. And the guidance counselor said, well, this is it. This is what you can do. This is what you're left with. So it was so last minute. And so that's what inspired me to do it. It wasn't because I wanted to be a dentist. It was because I didn't want to be a researcher. And luckily, everything fell into place. Like I had the credits, I did well on the DATs. So the stars aligned and I became a dentist.
Oh, okay. And then also going back to those earlier years, so you mentioned that you only studied for the DAT for a limited amount of time. We were wondering, so what kind of tools did you use in order to do that? Since you mentioned that all the resources weren't available as much.
Yeah, it's true. It was a different time back then. So we didn't have study clubs and the internet. So I just focused on the soap carving, which I know you don't have to do this year, and the spatial analysis. So I did sample tests. I kept doing those over and over again. That's how I prepared. And luckily, all the science questions pertain to things that I was recently studying during my 4th year.
Okay. And for your personal statement, how early did you start on that, or what steps did you take in order to start thinking of ideas?
Okay, so again, because it was so last minute, what I did was focused on the DAT, which was November, and then I spent December focusing on my personal statement, and then at that time we had to apply by January. And what made me, so I looked at the things that made me stand out based from my peers, and that was I had a lot of volunteer experience in high school. I was a teaching assistant during my undergrad years, and I did advocacy, which I know a lot of people don't have experience with. For example, I was advocating, to free political prisoners. I was also doing things like fundraising for people in need, like creating my own opportunities. So if I saw that there was a group struggling, I would actually fundraise for that group instead of joining another organization. So I think it looked good that I had a lot of initiative and leadership experience. So I focused on that, and I focused on the feelings I had. Like, for example, I did fundraising for Jamaicans who were suffering after a hurricane. So I said, how I felt when I heard about their plight on the news. What I did was I figured out what can I do just as a single student to help them? What resources can I use? So it was all about my thinking process and how I grew as a person to it, and how I ended up achieving my goals, even though I had some struggles.
Okay, thank you. We got some more questions. Is anything you wish you had dental students?
Pardon me, what did I wish I could?
I'm not sure if you can hear me.
No, I can't. I wonder if you can write it in the chat.
Very sorry. I think my internet.
Yeah, I'm hearing every other word. If you like,
Can
you
you
can
hear
write in
me
the chat.
now?
Yes, I can.
Okay. Okay. Give me a second.
Is there anything you wish you had done as a pre-dental student? Yes, I actually didn't do any dental shadowing, and I wish I did, because I think that would have made me more confident in dental school, because during dental school, I always felt, because I got in last minute, I also got on the waiting list, and because my peers spent so much time getting into dental school, I felt like an imposter. So I thought that if I did some dental shadowing, that I would know that that's the right career for me, and I wouldn't keep second guessing myself as a dental student. So by dental shadowing, I wish I just spent a day with my dentist. That's really all I needed. And I didn't even do that.
Okay. And we have another question. How do you get your patients to be so comfortable with you?
Oh, that's a great question. I actually start off right from the beginning. So when they walk, so I'm the one who gets them from the waiting room, not the assistant. I greet them with a big smile. I hang up it's as if they're coming into my own house. So I walk them into the room. I hang up their coat. I ask them if they want a drink. I, I help them into the seat. And before I start anything, I just sit down in front of them and just say, how are things going? How's life? Like, I don't talk about teeth at all at the beginning. And at the very first patient appointment, I'll say things like, tell me about yourself. What are you interested in? Tell me about your family. It's the same thing you would do to someone you just met at a coffee shop or a party. That's what I do with my patients. And it's the greatest feeling in the world when someone says, wow, I can really tell you love working here, or I love coming here. This is so much fun. It's because I treat them like a friend. So, and you all do that with each other. So just do that with your patients.
Yeah, that's a very good point. And we have another question as well. They're wondering if you can share more about your dental charity work and other volunteer work that you do.
Oh yeah, that's great. So with the dental charity, I got connected with them from a friend, and I'm on the board of directors, and we do free dental days. So I'm even organizing one coming up at a homeless shelter. And I've done a lot of free dental days with my local dental association, where we go to food banks and ask them to advertise the events so we know that the patients are really in need. So you can do a lot of volunteer work locally. And during the pandemic, I actually did it outside. I did free dental screenings outside food banks. So, I didn't let anything get in my way. And I thought, well, I can't do dentistry, but I can do free dental screenings and give advice. You can even do classroom presentations by promoting oral health. That's prevention. So and it doesn't take a lot of money. It doesn't take a lot of time. It just takes some initiative.
Exactly. And you mentioned that there are certain procedures that you can't do working at the public health. Mm-hmm. I was wondering, what is your favorite type of procedure to work on?
Oh, that's a great question. My favorite thing to do is the baby's first dental exam. Like the little 1-year-olds coming in and they only have their 2 front teeth. The reason why I love it is because that is the child's first dental experience. And if you teach the parent, oral hygiene habits, dietary habits, teaching them the importance of oral health, like that sets the stage for that child's entire life to have good oral health. So if you establish habits early, you're going to prevent a lot of problems. So I love that, like creating trust early on.
Definitely. And then we have about 2 minutes left, but before that, you mentioned that there is continuing education as well. So I was wondering, how does that work, or what type of schooling does that require? What type of schooling is involved in that?
Okay, another great question. So in order to maintain your license every year, you have to do continuing education. So you can do it on your own, like by watching webinars. You can go to in-person courses locally, or you can fly across the world and go to dental conferences and do it that way and have some fun with it and go with your colleagues. So there are a lot of different options.
Okay. Sounds great. Well, I think we can end it there. Again, thank you so much for coming and speaking with us. We got a lot of comments saying you're already their favorite dentist, so
Aww, thank you.
impactful.
And I wish all of you the best of luck in your dental journeys. I can't wait for you to become my colleagues and we can all work together.
Yes,
Thank you very much, Janine. Thank you, Sophia. Thanks to all of you for joining me tonight. Thank you.
Oh, thank you so much.